So the main problem that we're trying to solve is to help breast cancer surgeons identify cancer more accurately during surgery. At the moment, when they remove the cancer, they're really just relying on the sense of touch or their eyesight to try and make sure they got all the cancer out. So what we want to do is provide them with high-resolution imaging that will enable them to more accurately remove the cancer. Currently, in between 20 and 30% of cases, the pathologist finds that the surgeon missed cancer, and when that happens, they have to go back for another surgery. So our solution to this problem really goes back to what surgeons use in the first place, which is their finger. A tumor is often stiffer than surrounding tissues. But the problem is something that feels stiff to one person might not feel as stiff to another person. So we want to quantify stiffness and also be able to see stiffness on a really small scale. What we really want to do is make a very compact imaging device. So basically shrink a microscope into a handheld probe that the surgeon can then use during the surgery. For each place that it's located, we take a three-dimensional image in less than a second. So then the surgeon can move to the next location and survey the entire cavity. It does introduce some engineering challenges. We're using a high-resolution imaging technique, but that means that it's very sensitive to any motion. And also we're measuring the stiffness, and we do that by pushing on the tissue. So a lot of the algorithms and techniques we've been developing in the last few years have been aiming to overcome that. Now we can achieve images with just as good quality with a handheld device as we can achieve on a benchtop. So this technology could really have a global impact. We're talking about hundreds of thousands of patients who might not need to go back for an additional surgery. It also minimizes the amount of healthy tissue that they need to remove. This technology could equally be applied to neurosurgeries, in the lung, in the liver, anywhere where the device could be placed, it could be used. I think one of the unique things about our team is that we're mainly a group of engineers working on a hospital campus. We see patients every day and we hear patient stories, and that's hugely motivating because at the end of the day, that's what we want to do to make a difference, is to improve outcomes for patients.